appreciate it. Ooh. We really appreciate it. So we're going to be discussing mental health. My name is Elena Chesnikova. I'm a third year majoring in neuroscience and philosophy.
Hey everyone, my name is Ava Henson and my pronouns are she, her, and I am a third year majoring in genetics and genomic sciences.
Hi, my name is Madeline. I'm a freshman. My pronouns are she, her, and hers, and I am a psychology major.
My name is Max. My pronouns are they, them, and I am a senior psychology major.
Hey guys, my name's Danny. My pronouns are he, his, and I'm a neuroscience major. Also, yes, I am in a car, but I'm not driving, so I don't condone that. So if you ever have to hop on a Zoom, don't.
Hi, my name is Sumay Juntkar. I'm a junior majoring in biomedical sciences, and my pronouns are she, her, hers.
Hi, my name's Madison. My pronouns are she, her, hers, and I'm a junior majoring in nursing. So I'm going to go ahead and start us off. So today, our topic is mental health and why it matters. And we're going to have a lot of different information about mental health and how to discuss mental health with others. So I hope that you all enjoy it. Okay, so we did want to give a bit of a disclaimer that sensitive topics will be discussed today regarding mental health. So we ask that you please take care of yourself and be self-aware. And if any of these topics are triggering, please feel free to step away from the Zoom meeting because this in itself is practicing self-care, which is a very important aspect of mental health. And we also want to mention that we are not trained mental health professionals. We are peer educators spreading mental health awareness and positive mental health. And if you are in need of someone to talk to, UAB has great resources. Some of these include the Be Well app, student counseling, and many, many more, which will all be discussed at the end of this presentation. So a little bit about the Mental Health Ambassadors. MHA is a peer-to-peer mental health promotion program. We strive to bring awareness to mental health, resiliency, and self-care. We do a lot of different presentations and collaborations and bringing different people in to talk about mental health. And we're also extremely active on social media, and we'll have all of our social media at the end of the presentation. And Mental Health Ambassadors also works in coordination with student counseling services as well.
Okay, perfect. So hi guys, we're just gonna do like a quick little interactive activity and just discuss mental health. So it's kind of view it like a warm up. So kind of unmute, jump in whenever you'd like. If you don't really want to talk out loud, you can just respond in the chat. That's totally fine. So I'll probably take around 2 to 3 responses per question, and then we can move on. So the first question is, what does mental health mean to you? And the table is free. So go ahead.
I would say for me, mental health is really about making sure that I have like the ability to do all that I know I can do. So, making sure that I'm in like the right headspace to, perform at my highest level and everything I do, and also to just enjoy life in general. Because I feel like, everything that you do is really just rooted in your mental health. That's sort of the starting point. So that's what it means to me.
That was really, really elegantly put. Oh my gosh, thank you, Daniel. Yeah, I could agree with you totally. Because, just like how we have to take care of ourselves physically, we definitely need to take care of ourselves mentally. So does anyone else want to jump in?
I kind of believe it's not to be so weight bearing on yourself. For me, at least, I'm very hard on myself and I want to strive for excellence. So sometimes it's kind of hard to have a good mental health when you're always trying to do better each time, because sometimes you're just too hard and then it kind of puts you down even more. So
Oh, wonderful. Oh, and we even have a comment. So guys, I'm so sorry. I feel like a teacher on Zoom. So to me, mental health stems from a quality of happiness or capacity to make yourself happy. That is really beautifully put. Thank you so much, Connor. Okay, awesome. So moving on to the next question, how can we encourage discussion on mental health in society or even at UAB?
I think a good way to do that is to provide a welcoming environment in terms of allowing people to share their own experiences And, it's going to be different for each community because, at least for me, I came from a family that had not a lot of acceptance for mental health, and I guess really lack of awareness on how mental health can affect someone physically as well. So it's definitely just educating the community, and yeah, to assure that people have a chance to open up.
Very true and really wonderfully put. Thank you for sharing that. And in the chat, Jules said to assure people that opening up does not mean that they're weak. I feel that would encourage some people if they knew that. Yeah, and that's really great. And honestly, even just like attending this presentation is an example of that. We're here kind of just discussing that and creating a community that it's open, to share. So yeah, okay. So moving on to the next question. How does academic stress affect your mental health? And I'm saying this specifically because we're going into April and that's like finals month. And I want you guys to pay attention to your mental health in that time. So any ideas?
I would say just like the pressure to do well, especially just when you have a lot going on academically, can be like a sort of a detriment to your mental health. Like, I think it's just like a balance because I feel like, having like a goal and like, having to try to do well is in itself good, but it can definitely sort of be overbearing at times, especially during finals.
Very true, very true. Especially Daniel, since we just talked about the paper that we both have to write tonight. So that's really funny. Oh, another one in the chat. So Connor said that there's a strong negative correlation. That's very, very true. Really, people are extremely hard on themselves to achieve well. And, when they feel that way, they often like refuse to do self-care, and in effect, that really damages their mental health. So yeah. Okay. Last question for the night. Then you guys, you'll get rid of me. You don't have to talk anymore. But what are some ways that you take care of your mental health? And this can be like personal or general. Just feel free. Throw your all into it.
For me, oh,
Okay, you can go first.
oh, for real, appreciate it. For me, I like to go on runs. I don't know about y'all, but for me, going on runs really helps. It just kind of clears my mind and really just focus on something other than school, kind of on the more physical aspects. So I can work on my physical health as well and just get away from all the school.
I love it. And for me, I just love turning on my favorite song and just belting the lyrics out at the top of my lungs with the music up.
That sounds beautiful. I agree. I wish I can do that. I'm like in a building where like walls are thin, so my neighbors would really hear me if I did that. So I have to like settle with like quietly singing in the shower. But yeah, and also I see in the chat spa day. I really like that because I make everyone around me in my life do face masks with me because I love them so much, and that's like my personal self-care. So guys, thank you so much for participating in our discussion. I hope that like your answers and other people's answers kind of gave you some insight into how they viewed mental health. So thank you so much.
Thank you, Elena, for leading such a great discussion. And everybody had such great answers. I love it. So naturally, we can't give a presentation about what mental health is without really talking about the definition of mental health. So it's important to understand that mental health is very multifaceted. It can be impacted by lots of different things, but overall, it really includes our emotional, psychological, and social well-being. Additionally, there's many different aspects that can affect your mental health. So things like biological factors and genetics, maybe life experiences, your family history, and even like your lifestyle can all impact your mental health. And in return, mental health can affect your daily way of life. So things such as your health, your like physical health, your mood and your stress levels, as well as your ability to make decisions, are all things that can be impacted by your mental health. A positive mental health is really important because it can allow you to realize your full potential as a human being. It can also help you cope with stressors that are going on in your life, as well as work more productively and help contribute more positively to others. That being said, mental health is super important and should be included as one of your top priorities. And maintaining a positive mental health can definitely be difficult. I will be the first to mention that. And we mentioned that previously in our discussion about how it can be really hard, especially with things like academic stress and everything going on. But it is important, and there's many ways you can do it. So self-care is a great way. We talked a little bit of that too, like Elena mentioned with her spa day, amazing, great way to practice self-care, but also maintaining being physically active is helpful. Maybe helping others, getting enough sleep is really important, that I think we always forget about. I definitely forget about that one. And also getting professional help when you need it is important. So we also want to talk about mental health as it relates to a demographic that is most relevant to us. So that would be the college student demographic. And according to an article released in September 2021 from Mayo Clinic, up to 44% of college students have reported having symptoms of anxiety and depression, and 30% of students have reported feeling depressed in the past year. Additionally, around half of students have reported feeling overwhelmingly anxious in the past year. So these statistics kind of just go to show that college students and mental health struggles are not unfamiliar with one another. The college student experience is very unique in the sense that you're kind of in this transition period between childhood and being an adult, and you now have all these responsibilities on top of classes and learning how to function as a human being in society, and then figuring out what you want to do with the rest of your life is also a big one. So that can be very overwhelming, and actually can have a more negative effect on your mental health. So with that said, it's really important for us to be having this conversation with you right now, especially because suicide is one of the leading causes of death for college students. So all those things that I mentioned before can be super overwhelming for a college student. And despite that statistic, up to 75% of struggling students are reluctant to seek help, whether that's because of the stigma surrounding mental health struggles and getting mental health support, or maybe they're just not aware of the resources that they have available to them. So it's important for us to be talking to you about this right now, because if you're able to recognize the warning signs and risk factors among college students, so among your peers and your friends, you can help connect them to the resources that they need. So many universities, including UAB, have mental health services on campus that are accessible to students. And UAB has a ton of great resources that are all free to UAB students. And I will not mention them here because we have a bunch of them at the end of this presentation to mention. But yeah.
So I want to talk about the importance of mental health and just some of the misconceptions, and then about the importance of having a good work-life balance. There are a lot of misconceptions when it comes to mental health, that mental illnesses can't be treated, or that people with mental illnesses are lazy or violent or insane, and that visiting a psychologist or a psychiatrist has to be a scary experience. Mental illnesses are real, just like illnesses in your body. If someone is having heart trouble, you would want them to see a doctor. And the same goes for mental illnesses like depression, anxiety, and OCD, and all of them. And I know Ava already mentioned some statistics, but if you look at these numbers on this slide, 73% of students experience a mental health crisis in college, and 80% of students felt overwhelmed by the number of things they had to do. So if you're struggling, know that you're not alone. And we're going to mention them a lot, but UAB has a lot of resources on campus and online to help you. And you're always welcome to reach out to me or any of our other awesome mental health ambassadors if you want more information. One of the most important things you can do to help protect your mental health is to maintain a healthy work-life balance. It can be really difficult to balance the many demands you have. And I know, as a student and a family member and a friend, and as a person who deserves to be physically and mentally well, there are only so many hours in a day and you can only do so much. So strive to do your best without worrying about being 100% perfect on everything you do. Try to keep a to-do list and prioritize tasks, and make sure you plan some time to do things that make you feel good, like going for a walk, or listening to music, or hanging out with friends, or any of the self-care things we talked about in our discussion. And remember to take care of yourselves, and know that there are lots of people here who want to help you if you need it. So please reach out to us.
So along with knowing the importance of mental health, it is important to learn to recognize early warning signs of mental illness. This way you can help yourself and or others. The American Psychiatric Association has listed a few warning signs and symptoms of mental illness that you should watch out for. There are a lot of emotional signs that can occur. Like, for example, you might notice that you're having sudden mood changes that could cause you to have emotional outbursts. You could be feeling this constant anxiety, which then causes you to become quieter than normal in social settings and have a feeling of guilt. This could affect your performance as well, as you could have problems with concentration. Other signs include loss of sleep and appetite, which overall reduces personal care and can harm your body physiologically. Additionally, some people may resort to substance abuse, which can also become a huge problem as that can substantially harm your body. Therefore, these are some of the common signs that can be recognized as early symptoms of a mental illness. If you find yourself or others having the signs that were listed earlier, these are some of the steps that you should consider taking. First, learn to value yourself by treating yourself with kindness and respect. Taking care of your body is also a way to value yourself. Be sure to stay hydrated, eat healthy, and get adequate amounts of sleep. Learn to surround yourself with good people and try to move away from the toxic people in your life. This is easier said than done, but you can do this by attending fun social events and activities. Along with helping yourself, try to seek opportunities where you can give back to others. This is a great way to help you feel self-accomplished. An important task for college students in particular is learning to deal with stress. Take some time to assess what your stressors are and learn ways of calming yourself down. An easy way to calm yourself down is by engaging in mindfulness activities. This can be done by breathing exercises, meditation, taking a walk in nature, or any activity that will help you take your mind off of your stressors for some time. Another task that college students should learn is how to set realistic goals. This is also a way to reduce your stress, and you can learn to appreciate yourself more when your goals are accomplished. Learn to avoid alcohol and other drugs as that can be harmful to your body. And lastly, never be afraid to reach out and get help. There are a lot of resources at UAB's campus, off campus, and online that can assist you, and this will be further discussed by Max.
So these are the sources that we use to make this presentation. And if you want to, see any of the information we use, you can, take one of these links. And if you need us to go back to this slide later, we can. So here are the student resources we have available here on campus that we've mentioned multiple times so far. So student counseling services are great for any problems you might be having, either just in your life, with your workload, your mental health. You can talk to them about anything. The Counselor in Residence is a mental health counselor available to all on-campus residential students and is available to get everyone more access to mental health help. Both student counseling and the Counselor in Residence are completely free to students. Disability Support Services is available for individuals with any and all disabilities, and they will work with you to help provide accommodations on campus and in your classes. Nutritional counseling at the Campus Recreation Center allows you to speak with a registered dietitian and help keep you on track to reach your health and well-being goals. Student assistance and support supports students through life challenges and connects them with university and community supports to best address their diverse needs through individualized assistance. They are a great place to start if you're not exactly sure where to go for help. Title IX is a federal civil rights law passed as a part of the Education Amendments of 1972. This law protects people from discrimination based on sex and education programs or activities that receive federal financial assistance. Title IX office upholds this law on our campus by helping to provide an environment free of discrimination based on gender. It also helps individuals on our campus to contribute positively to the environment and to refrain from behaviors that threaten the freedom or respect that every member of our community deserves. If you feel you have been discriminated against based on your gender, or if there's an incident you need to report, or even if you just want to know more about these topics, the Title IX office is the place to go. There are also plenty of off-campus resources that can be of great use. The UAB Community Counseling Clinic offers affordable counseling services to the residents of Jefferson County. Well-trained graduate students, supervised by experienced faculty members, conduct all the counseling sessions. This is a great resource if you or someone you know can't afford the cost of a typical therapist. The Birmingham Crisis Center is to serve people experiencing personal crisis or mental health issues and respond with services that promote coping, emotional health, and well-being. The National Suicide Prevention Hotline is available for anyone to call 24/7 if they feel like they want to end their lives. Even if you aren't planning to end your life, if you have those kinds of feelings, calling the hotline can really help. There are also online or app resources available to you. The Be Well UAB app is a self-care app, and it is available on both the App Store and Google Play, so no matter what type of phone you have, you can access it. This app originated from the discussions with the Student Counseling Services Advisory Board and our student government associations. The Together All app is a safe online community for university students across the United States to share feelings anonymously and get support to improve mental health and well-being. And this is monitored by licensed and registered mental health practitioners. Therapy Assistance Online, also called TAO, is free and available to all UAB students. TAO Therapy is an online platform of tools and educational materials to help you learn about and change how you think and feel. All the resources are incredibly helpful and can help with many of your needs. Using these resources is a way to practice self-care because you are taking care of your mental health just by reaching out. And if you don't know what you need, just ask. The mental health ambassadors are always here to help. And then these are our social media handles. If you're interested in learning more about the mental health ambassadors here at UAB and getting involved, we're on multiple social media platforms. Our Instagram has regular posts and interactive Insta chats where one of us goes live and has a conversation with the viewers. We post recordings of many of our events to our YouTube channel. Our podcast archive is a podcast designed for listeners to hear personal mental health stories from a variety of different backgrounds and cultures.
Well, first of all, shout out to all you guys for doing an amazing job. And with that, if you guys have any questions about anything that anyone talked about today, here's the links for the emails rather for everyone that was here today and presented, as well as Dr. Lonzi and Dr. Stowe, if you might have any questions for them. I promise you, we're nice, we're approachable. If you guys have any questions whatsoever, please don't hesitate to ask us. I'm sure everyone here would be more than willing to help or help in any way that they feel like they can. And as always, thank you guys for attending. Our next presentation is going to be on April 18th at 6 p.m. And we're going to be talking about resiliency through finals, which I'm sure is something that we can all relate to with this horde of finals and exams coming up on top of all of us. I'm sure it's something that we all understand. I'm also going to be sending a link in the chat for a form. If you guys could take just a couple minutes to fill that out, it's only a couple questions. It'd be greatly appreciated. And again, thank you guys so much for coming. It was amazing to have you guys, and we'll see you soon.
Have a great night, guys. Bye-bye.
Y'all did a great job. That was really good.
Thank you.
You too.
Well, if y'all don't have anything, I mean, y'all are good to go. Oh, let me stop the recording.